So thank you for this opportunity to talk a little bit about what our health division does for Sutter County. Basically, our health division is seeking to create a healthier Sutter, so this is a great kind of a segue into what you just heard. Our Sutter County Health Division, actually, if you look at the picture there, is taken by one of our staff members in Health Education Unit, very skilled staff that we have in Health Education. They take their own pictures and put them up all over the community. But basically, since 1900, the average American lifespan has lengthened by 30 years, and 25 of those years can be contributed to the efforts of public health. And the achievements in the 20th century are due to the vaccination efforts throughout the nation as well as the rest of the world. We don't have smallpox anymore. We've eradicated polio in the Western Hemisphere. We've improved sanitation by not having cholera in our communities. There are fewer deaths of heart disease, healthier babies and moms, and a reduction in tobacco use. But despite these many advancements, we're still seeing some challenges. We're seeing a lot of chronic diseases in our communities. We've had the H1N1 a couple of years ago. We have new and re-emerging infectious diseases like measles that we saw last year, and natural disasters that public health responds to. So public health is everywhere. It's at work every day, and it affects everyone. On an average week in Sutter County, we see 25 births, 14 deaths, 7 pregnant women receive late prenatal care, 2 teen births occur every week, 5 cases of chlamydia are diagnosed, 1 gonorrhea case. We have 2 heart disease deaths in Sutter County, 3 deaths due to cancer, 1 due to stroke, and 1 due to unintentional injury. This involves public health a great deal. So our public health division is divided into some units. Our business office unit actually provides assistance in invoicing over 22 grants, which brings in $3.1 million in revenue. They enter about 3,500 immunizations into a state and a local immunization registry. They receive, tally, and file about 2,200 immunization assessment forms, attend to about 8,400 phone calls a year, and attend to a little less than 7,000 walk-in clients every year. So annually, our staff review and register 2,082 births into a database system called the Automated Vital Statistics System. They issue about 1,500 certified birth certificates. They register and review 492 deaths that occur in Sutter County, and they enter it into the electronic death registration system, and they also issue burial permits. A total of 1,984 certificates, death certificates are issued annually through our business office. Our nursing unit, our public health nursing unit, comprises of a whole lot of programs. California Children's Services, which you've heard a lot about over the last year, serves 630 children. These are children with serious medical conditions. They're case managed by about 4 staff. We have a program called California Child Health and Disability Prevention Program. There are 800 well child exams that are performed locally by our pediatricians. All of those forms come through our office, are reviewed to make sure that adequate follow-up is going to be received by these patients. Approximately 70 moms are visited in the hospital by a public health nurse after delivery. 140 children in foster care receive public health nurse case management services. We have a childhood lead poisoning prevention program where about 10 children annually are followed by a public health nurse who are lead burdened. And there's a lot of education and community outreach to reduce the lead burden incidence. Also in the public health nursing unit, we have an immunization program. About 200 children and adults are vaccinated every month through our clinics. We have approximately 2,000 children and adults that are vaccinated with flu influenza shots. And we actually provide those annually through a DriveThru flu clinic. This past year was at Riverbend Elementary School. We had a flu clinic at Live Oak Community Center, and then 5 schools. We designate 5 schools where our public health nurses and nursing staff go in and vaccinate the children. We have also a walk-in immunization clinic. A lot of outreach and education to the community as well as the medical provider sector related to any updates on immunizations. I bring these pictures to you to show you that immunizations are still necessary in our world. We're not immune to any of these diseases. This child on the upper left has been diagnosed with whooping cough. We have about 11,000 cases diagnosed of whooping cough in California in the year 2014. 456 cases were hospitalized and 3 deaths occurred in infants. These are vaccine preventable diseases. Measles, last year we had 134 confirmed cases, and among those who had a vaccination documentation, 57 of those folks whose records were reviewed were unvaccinated. 25 of those cases had 1 or more MMR vaccine. So immunizations are still necessary in our communities. So just to give you an idea, in the fiscal year 13-14, Sutter County in child care, kindergarten and 7th grade entry were very close to the statewide averages. A community that has 90% of its population vaccinated can be what's called almost free from disease by having herd immunity. So those 10% that do not become vaccinated for whatever reason, if they're immunocompromised or they don't believe in immunizations, if the 90% of the community is vaccinated, we should be in good shape. So the closer we are, or the more we have above 90%, the better. So in fiscal year 14-15, we definitely improved in all of those 3 areas: the child care sector, our kindergarten entry, and 7th grade entry. In our public health nursing unit, also we have maternal, child, and adolescent health, where staff are working to increase breastfeeding rates. They increase early prenatal care access and try to decrease sudden infant death syndrome deaths. So also a big part of our public health nursing unit is our infectious disease investigation and control section. We receive reports from our medical community on over 80 diseases that are reportable diseases by law. Examples are like hepatitis A, B, and C, norovirus, West Nile virus, measles. So each of those cases that we receive from the medical providers' offices are reviewed and they're checked to make sure that the cases are receiving the adequate treatment and education. Also, we case manage individuals who have been diagnosed with sexually transmitted diseases. We also provide condoms at our health department to prevent spread of disease. In addition to all the other communicable diseases, tuberculosis is one of those of interest usually, but we don't have a very high rate of TB in our community. Annually, we see about 2 cases which require direct observed therapy for about 9 to 12 months, which means the nurse has to go to the residence or the place of work to watch this person take the medication so that they don't miss doses. And the purpose for that is if they miss doses, then we might end up with multi-drug resistant tuberculosis, which is a bad thing for us. So we have a number of cases that are suspect cases, which requires a lot of investigation and a lot of work. We provide TB tests through our clinic. There's also HIV surveillance. We receive about 450 bite reports annually from animal bites, and we make sure that those individuals who might be exposed to rabies has the appropriate care that they need to prevent that. Another section in our health division is jail medical services. In the jail setting, we provide a clinic which we have doctors and nurses that are providing sick call, physicals, nursing assessments. We provide medications in the cells. There are treatments including radiology and laboratory services. There's release planning where our nursing staff will work with the inmates who are ready to be released into the community to make sure that they have adequate care in our community, that they have applied for Medi-Cal if they need to have Medi-Cal to cover their costs for any follow-up care that's necessary. We also refer out to other medical entities for emergency services, dental services, and any surgical interventions. We also have immediate response through our jail medical services, where nursing staff are monitoring patients in our safety and sobering cells, and also making sure that there aren't communicable disease infections that are, they're basically surveilling those. I'm going to go ahead. So in our jail medical services program, there's a paradigm of improvement. Our program has improved chronic health outcomes. We identify patients who have a chronic disease, and we are going to start to enroll them into our chronic care program, where they'll be scheduled for regular checkups and treatment plans. This has been known to improve health inside and outside of the jail setting. With the addition of the release planner, our patients receive services that enable them to continue to take care of themselves when they are released from the jail setting. And this hopefully will reduce the burden on the county resources when they're not incarcerated, if they're taking care of their health when they're outside. Should they come back into the jail setting, they're not having such a bad need, high need for case management. There's been improved communication in our jail medical services program. Our responsible health authority meetings are happening regularly, where our jail medical services, behavioral health services, and custody staff come together, and we talk about cases that we need to coordinate on and improve the efforts of day-to-day issues that might come about. We also have multidisciplinary team meetings where it involves medical, mental health, release planning, and custody, where we're continually discussing the health of the inmate population. So again, another paradigm of improvement, we're constantly improving the safety, in patient safety and staff safety, which includes a formalized suicide prevention and sexual assault response plan. The intake process has been improved to provide better identification of patients who have serious medical conditions, and we case manage the high acuity patients with the staff that we have. And we have also made changes in medication administration, where you have less chances of patients cheating their medications, and possession of medications is contraband. The standard of care, our policies and procedures have been written and revised to reflect national standards. We're actively pursuing accreditation with the National Commission on Correctional Health Care, which is a nationally recognized highest standard of government correctional facilities. We have now met 75% of the requirements for accreditation and are currently close to meeting 100%. As part of our efforts towards accreditation, staff members have obtained or are preparing to obtain what's called a specialized certification in correctional health care. One of our jail nurse manager currently is a certified correctional health care professional, and 3 of our other RN staff are seeking that same certification. Go ahead here. So we have had an improved patient satisfaction. 33% decrease in grievances happened in year 2015 versus 2014. 76% have were resolved during the first step with education and an explanation of policy. I'm just going to summarize this inmate's comment. Just recently, I know my wounds wouldn't have been healed this good on the outside. You guys saved my arm. So our staff are working very hard to continually provide standard of care to our inmates and make them healthier individuals when they exit the jail system. So our another section of our health division are lab services. Through our labs, we are seeing less and less testing over the years, primarily because there are many private labs that are providing similar services. Currently, we're doing minimal testing of water. We're doing rabies testing and parasite testing. We do package and ship to other laboratories for references. And we'll be coming back to you in the near future to talk a little bit about the future of our laboratory. So the Sutter County Health Education Unit has continued efforts to provide costly chronic care programs and promoting healthy messages throughout the community. They have a media campaign which includes these canvas images seen here. These pictures are taken actually by our staff, one of our staff members. These images are posted on banners and posters, and social media tools they're displayed all over the work sites and organizations and schools. So our health education unit continues to strive to make our community healthier, but data from our California Health Information Survey reveals these alarming statistics in Sutter County. 2 out of 3 adults are overweight or obese in Sutter County. 1 out of the 9 have been diagnosed with diabetes, and 1 out of 3 adults have high blood pressure. So our staff in health education use 3 evidence-based approaches to address preventable chronic disease conditions through education, advocacy, policy systems, and environmental changes. The nutrition education has resulted in positive behavior changes like reduction in sugar, sweetened beverage consumption, and the advocacy about bringing community leaders together to discuss and identify simple solutions to identify and address obesity and diabetes. Implementing policy systems and environmental changes by supporting local businesses and organizations that adopt tobacco, sugar-sweetened beverage, and candy-free events. And this, in October, we actually had recognized 4 entities: Right Out Health Incorporated, Yuba City Downtown Business Association, SunSuite, and Kiwanis for the policies that they implemented to making healthier events when they had their large events occur. A recent survey of Sutter County residents reveals that 90% of the residents prefer to attend outdoor events that are smoke-free. Emerging nicotine products like electronic cigarettes that are on that little sign there have brought new challenges to us. The health education staff have been working really hard to educate community leaders, parents, and youth about these new products. They created 2 DVDs about the costly and preventable health conditions in Sutter County. These DVDs were recognized nationally for the education that was provided to the community. Our health education unit also has formed a youth group called the Student Advocates for Sutter County, and they are actually working with community leaders and community organizations and elected officials to talk about the secondhand smoke and smoke-free areas. They presented at the Yuba City City Council and were successful in getting an amendment to an existing smoke-free park and entryway policy, which included electronic cigarettes. So we have an emergency preparedness program through public health. There are a variety of funding sources and purposes for this. We have a public health emergency preparedness program funded by CDC, pandemic influenza funded by California State General Funds, another grant involvement, state Homeland Security grant, and healthcare preparedness program grant. Our emergency preparedness program, the major functions are a medical health operational area coordinator program, works with the Sierra Sacramento Valley Emergency Medical Services, and basically is providing emergency communication and direction to healthcare providers. And how is public health preparing? We actually have all hazards plans, purchase equipment and supplies that would help us to be able to respond to emergencies. We train our staff, we have drills and exercises, annual DriveThru flu clinic, and we're constantly coordinating with other organizations, both regionally, locally, and with the state. So this is just an example of what kind of equipment that we have purchased. We have connexes full of emergency response supplies. They're located in Yuba City and in Sutter. We have a number of communication tools, satellite phones, and a lot of equipment that would help us to be able to communicate with one another as if there was an emergency situation. The picture there kind of shows the drive-through flu clinic. This is just an example of what we do annually during October, November months. We have a child development behavioral specialist, which is funded by the First Five Commission and Social Services. This position actually works with families with children under 5 years of age in teaching families about parenting, education, and support. They reach out to about 1,400, she reaches out to about 1,400 folks annually. She provides workshops throughout the community. It's a great asset to have in our community. This is the last one. So Women, Infant, and Children program actually serves about 37 participants per month. It is a program that is for individuals or families that are 185% or below the poverty level. There are registered dietitians and trained nutrition counselors in this program. There's breastfeeding support provided by lactation consultants. Checks are provided to families for healthy food. The value of these checks can range from $60 to $140 a month. These services are provided at 3 different locations: at the Health Division, in Live Oak, and at Richland Community Center. WIC program brings in about $250,000 monthly to local markets. It supports local farmers during the farmers market season by reinvesting nearly $60,000 yearly into the local economy. The WIC program also addresses the chronic disease issue. They are teaching constantly about how to eat better and move more. And they provide linkages to services. I also wanted to point to you, I think you're reviewing the document that I placed on your portrait of Sutter County, which is a 2015 Children's Health Report. This was actually produced by staff at our Health Division. A lot of data compiled from various resources, Centers for Disease Control, CDPH, all kinds of other. I'll open it up for questions. I apologize for the length.
Any questions from the board? Comments?
Well, Mr. Chairman, I'd like to thank Amerjjit. This is a lot of information, and obviously it's worthy of getting it out to the public, but I really appreciate you bringing this to the board. But also, like I've told other department heads before, is like anything you want to get out to the public, please utilize our Public Information Officer, Chuck Smith, and he can get it out as well. So once again, though, thank you for your presentation. It's very informative.
Thank you.
Mr. Chairman. Also, Amerjjit, how long have you been with Human Services?
28 years.
How long?
28 years.
28 years. Well, first of all, thank you for your service, and you do an excellent job, and this was a great presentation. And I think it is important to bring this to the board and to other folks, because a lot of times, at least in my district, I hear about public works, I hear about, planning and, other departments, and many people do not realize the services that the county does provide through your department. So thank you.
Thank you.
Mr. Chairman. Amerjjit, I just want to say thank you as well for your presentation. It was very detailed. Give us a lot of information. It's very helpful. I know serving on the committee with you and seeing you basically every couple of weeks, that we talk about so many different issues, and I learn a lot about what goes on with the county. And this is you've done a good job covering a lot of those things and the things that we do to serve. I use the DriveThru clinic myself for the flu shot, and that was great. I mean, just in and out in less than 5 minutes, and it's very useful. I'd encourage anyone to go through and use that service at least. And I just want to say thank you again. Thank you for your service. You've done a great job. I didn't realize you've been 28 years. I never knew that. So you started when you were 8, or yeah. But
like
just
that.
a great job overall in presenting. And it's great to be able to get the word out about this information, because like as Supervisor Levesque mentioned, so many people don't realize all of the different things going on at the county all the time. I mean, I've heard comments in this room just in this last year saying, well, you guys only go to 2 meetings, a month, and there's so many things that go on and so much to learn and so much to be a part of. And I just want to say thank you again for saying it.
you.
Appreciate it.
Good. Any comment on? No, I sit on that same committee with Supervisor Flores, and I too learn a lot. You know, I kind of refer to it as our necessary evil committee meeting, because anytime it involves giving away taxpayer dollars to those that are less fortunate, or in some cases that are taking advantage of the situation, it seems as though sometimes they can get better care from our own health department than they can, you know, the people that are pulling the wagon can afford to pay for. So it's a learning experience, and the good news is that most of the work that is done by that department is reimbursed. So it really, you say it doesn't cost the county anything. Well, we all fund it from our taxes, but the reality is it doesn't come out of the Sutter County General Fund. So that's the good news. You're doing a great job.
Thank you.
Thank you, Amerjjit. I think the report's very well, and your staff did a good job putting it together. Some of these numbers are pretty astonishing, you know, when you look at them, and I didn't realize a lot of them were that big. So it was good information. Thank you.
Thank you. I just want to thank my staff. They work very hard on a day-to-day basis. They are very, very cognizant of all the challenges on a daily basis, and they do the best they can. They are doing a tremendous job, actually, and I want to thank them for what they're doing.
Good. Thank you, Amerjjit.